Very well, it's now time for Perspective. And of course, tonight, like I had mentioned earlier, our main focus is on mental illness. Of course, statistics continuing to grow, indicating that globally, at least 800,000 people die annually as a result of suicide. And when we look at statistics in Kenya, it shows that about 4.5 million Kenyans, that is about 10% of our population, suffer from some form of mental illness. That means in at least every 4 people, at least one will at some point in their life have some form of mental illness. And that is what we're trying to focus on today. And we just want to see why is it that there appears to be an increase in mental illness, and what can we do as a people to try and address this particular challenge. And for more insight on that, joining me now in studio is Dr.Syengo Mutisya, who is a consultant psychiatrist. Thank you very much for coming this evening.
Thank you.
Okay, and I just want us to begin from the point of numbers. We always like to know, what are we dealing with? Statistics in Kenya. What would you say is the situation when we talk about mental illness?
Okay, we know that in Kenya, 1 in every 4 people have suffered from a mental health condition will suffer from a mental health condition in their lifetime. Mm-hmm. But we also know 10% of the population at any given point are suffering from a mental disorder. And also, as we talk about the global statistics on suicide, mm-hmm. we know that in Kenya we lose about 1,400 every year due to suicide.
That's about 3 to 4 people daily.
Yeah, 3 to 4 people daily. And for every suicide, it's about 25 cases of attempted suicide for every successful suicide, because you can attempt suicide and you end up being rescued and treated. So the suicidal attempts are more than the completed suicides. Mm-hmm. Yes.
These statistics, obviously, they come from some point. In terms of, what are some of the telltale signs? How do you know when someone perhaps has a mental illness or when they're about to commit suicide? Are there any telltale signs that perhaps we should look out for?
Yeah, basically, many cases of attempted suicide are due to depression. Mm-hmm. And when we are talking of mental illnesses, we basically look at changes in person's behavior or thoughts. And so you find that somebody who was outgoing starts being withdrawn. Some will say they feel sad. They will lose interest in things they enjoyed. They would not want to go to work, for example. They would not want to participate in things, their hobbies. And many of them initially would be able to say they feel sad. And the worst is when they start wishing they were dead, that mm-hmm. they would rather be dead than continue the suffering. Mm-hmm. Yes.
Okay. You've talked about depression being one of the forms of mental illness. What are others?
Mm-hmm. Yeah, there are various types of mental illnesses. The most common is anxiety disorder, where people have excessive fears. Mm-hmm. And we also have depression is also very common, especially among women. And severe untreated depression can complicate with the suicidal attempt. We also have other severe mental illnesses like bipolar mood disorder, where somebody will alternate depression with a manic episode where they have a lot of energy, mm-hmm. they talk a lot, they don't sleep, and they're still very energetic. We also have one of the severe illnesses called schizophrenia, mm-hmm. which is about 1% of the population, which many people would say call people mad when they have schizophrenia, because they lose touch with the reality. They might hear things other people can't hear or see things which other people can't see. Many people don't understand that substance use disorders, alcohol and other drugs of abuse, addictions are also mental disorders. Mm-hmm. We have disorders which will present basically in childhood, like attention deficit hyperactivity disorder. Mm-hmm. We also have autism disorders, which again would be diagnosed early in life. Mm-hmm. So there are various, of course with old age we have also Alzheimer's disease. There are many types of mental illnesses, including personality disorders. Mm-hmm. Yes.
But in terms of diagnosis, how can one be able to get that diagnosis? Because a majority of times we sail through life just saying, Nico na stress. We just never really get down to going to get tested to find out if we have some kind of disorder.
Yes, we say that if what you're feeling is affecting your daily activities, like if you find it's affecting your work, or it's affecting your relationships, or you're not able to cope with daily stressors, then you need to be helped. So you need to see a mental health professional. Mild cases might be treated with psychotherapy or talk therapy, but severe ones might need medication in addition to psychotherapy. And even severe forms of depression would need complicated treatments like electroconvulsive therapy, which is done in theater. Yes.
But how many of us really, bother to go and see a doctor, even just to go and see a psychiatrist or a psychologist to talk about our issues? How many of us really bother with that?
It's important because we say if you're not mentally healthy, then you're not healthy. You can't have health without mental health. So, and basically, if, for example, you are depressed, you don't perform to your potential. And we say the only way you can know that you're mentally healthy is, one, if you're able to understand your abilities, you're able to reach your potential, and you're able to adjust to daily stressors, and you're able to contribute to the society. So if you're not able to do that, then you're not mentally healthy. You need to consult. You may need basic counseling or talk therapy, or in some cases, you might even need medication. Yes.
Most of us, when we hear about mental illness, the first thing that comes to mind is Mathare Hospital. Do you think that is, the only place that we can be able to get this kind of help? What are the other avenues that Kenyans can use to go and get help when it comes to mental illness?
Actually, most of the private hospitals and the public hospitals are able to offer basic mental health care, because many general practitioners or doctors who have had their first degree are able to diagnose mental illnesses. Nurses and clinical officers also have training on mental health, and so they are able to diagnose and refer. So basically, any government hospital, they would be able to diagnose and refer the cases they are not able to manage. And the other gap is on the psychologist and psychotherapy. They are quite few. The number of psychiatrists are also quite few. So with time...
What is the number? Would you have the estimate number of psychiatrists that we have in the country?
Yeah, about 90 to 100, because some keep leaving the country, others are in private practice. So the numbers of psychiatrists are few, but that's why right now the Ministry of Health is training community health workers who can be able to pick and refer, but also the general doctors are also trained and are examined on on psychiatry, so that as they get out, they are able to manage basic common mental disorders and refer the cases they are not able to manage. Yes.
You've talked about referring. Let's talk about the referral system. How effective is it? How many people get referred and they actually go for that particular appointment? Do you have a system to follow up?
I think basically as we move to universal healthcare, where all the disorders are being covered, we are also pushing to have mental health be covered, including substance use disorders to be covered, so that if you need investigations or you need medication, you're able to get them wherever you are. And because most of the time access in terms of affordability is usually the issue. So once we deal with that by making sure that every Kenyan can benefit from the universal healthcare, and mental health services, including substance use disorders, are not left out, then many people, and as we pass information like what you're doing today, for people to know that mental disorders can affect each one of us. Many people think it's a disease of the other people, and they don't believe it when it's in the family. So by passing the awareness that mental disorders are there, they can be diagnosed, they can be treated, and people can live normal lives. Then if they are able to afford or they are able to access the services either through insurance, then they'll be able to be assisted.
As we speak, what is the general cost of treatment? I know there are different disorders, but generally, if you were to do a calculation, let's say for depression, how much time will you need to go to see the psychiatrist, and how much will it cost you? So
basically, it depends. We have categories, because you start with the primary treatment. If you that is not working, you move to the second line. So depending on what drugs or psychotherapy you're on, if you're in a public setup, probably it would cost like 1,000 shillings per month. That is in a government facility where you do not have to pay the doctor. But when you look at the private sector, it's quite expensive. And the challenge with public setup is where you find the medications are missing, so you have to go and buy outside. But if you are able to have an universal healthcare coverage where people are able to access treatment from government hospitals, and also the doctors who are employed by the government are able to offer the services, then we will not even be talking of huge costs. But if you are to do it privately, it's quite expensive because you might need treatment for at least 6 months. Basically, psychotherapy and medication is quite expensive if you're buying it from the private sector.
In terms of, treatment, once you get treated for whichever mental illness, is it permanent or there is the risk of recurrence?
Some mental illnesses might need, people suffering from some mental illnesses might need to take medication for life, but there are some like depression and anxiety. If proper treatment is done, then over time the medication are tapered down and psychotherapy sessions are also tapered down. So you may not need to live on medication or psychotherapy for life for some conditions, but there are some like schizophrenia where you have to be on medication for life. Yes.
All right. Why does there seem to be, what we would call an increase in mental illness? Because these days, every other time we are hearing, a man murdered his wife, he murdered his children, he committed suicide. Why are we tending to see this a lot? Is it that it's more awareness, or people are actually being driven to do these things?
We know that when there is increased incidences of trauma or losses, then we expect the cases of mental illnesses to increase. And as social support decreases also, we expect the cases to increase. Poverty, where somebody is not able to manage their basic needs, also would increase depression and anxiety. So as people, as social connectedness decreases, and as increment of traumas and losses in many forms, then maybe that could explain why we are having more cases. But media is also reporting more. There is also social media with information can be passed at a touch of a button. So if there's a suicide case somewhere, probably it gets to be known. So all those factors, but clearly there is also an increase in the mental disorders. Yes. Statistics
show that women tend to suffer depression more than men. Who do you know why? Because I assume that, women tend to talk more. You talk within the women groups and things like that, so you're likely to be less stressed, yet we are the ones who suffer from depression more. Why?
Yes. For a start, some depressions affect women only, like the premenstrual dysphoria, which is related to the menstrual cycle. There is also postpartum depression that will only affect women. And again, culturally, you would find that women, the society expects so much from them when it comes to taking care of needy family members or even actual taking care of a sick person. You find that the women seem to carry more than the men, and culturally many women are not able to make all the decisions they would want to make in their life. So you find that there is, yes, the biological predispositions, the hormonal makeup, and also the cultural factors. And generally, we know that even women doing the same job tend to earn less than men in the same job. It has been shown. So there are several stress factors which contribute to that. Yes.
Okay. Patients who, perhaps are diagnosed with the mental illness, are they willing to go for the treatment? Because there's also the issues about stigma around it, cultural barriers. When people in the village start saying that so-and-so is, mad, they don't tend to understand what really mental illness is about. So are the patients themselves even willing to get help?
Many of them might shy to seek treatment, but we always advise that if you do not seek treatment early enough, then the illness could worsen, and by the time you're being taken to hospital, you've lost touch with reality, which will even increase the stigma. So like you could be having mild depression, and if it's not treated, you go ahead to psychotic depression. So it's best to get treatment early enough, because then when you wait until it becomes severe, the stigma is even more. But I would want to encourage Kenyans to see mental illness like any other illness, and it can affect any of us, regardless of your class, regardless of your income, and not stigmatize mental illness, so that people can come and say, yes, I was depressed, I feel better, I'm on treatment for bipolar disorder, and I'm able to manage my life.
Are there many people who are speaking about it? Because we know in some cases, things like HIV and AIDS, we see people who come up and say, you know, I'm infected, and they go ahead and encourage other people. In terms of mental illness, do we have people who perhaps have gone through this and they're willing to speak to others about their condition?
Yes, we have many people who have come out. Every year we commemorate World Suicide Prevention Day, and we have several people who come out and talk about it, even in media. On 10th of September, on 10th of October, we have World Mental Health Day. Again, we have people who come out and talk about it. And even now, if you ask for volunteers to come and share their experiences, there are people who would be willing to talk about their experience with mental health conditions and how they are surviving and living with it. Yes.
What about in terms of funding and financing of mental health care programs? Is the government putting enough towards this?
I am sure as we roll out universal health care to take care of all disorders, mental health will not be left behind, and specifically substance use disorder, which the public views as a moral problem, an addiction, not being a disease. So I'm sure that as the government rolls out universal health care, they are not going to leave mental health behind, and also substance use disorders. Yes.
Is the existing act, the Mental Health Act, sufficient to perhaps protect the rights of persons who have mental illness, especially when they get, you know, committed sometimes to the hospitals?
The Mental Health Act is in the process of being revised. It has its gains, and it also has some gaps, and it's being revised. So far it is able to assist like people who are mentally sick and they don't realize they are sick, so their loved ones or next of kin is able to take them for treatment. There's also option of voluntary treatment, so you can walk into a hospital and say, I feel I'm depressed, or I feel scared when I get out. So you can actually walk in and get treated on voluntary basis. And for cases where you find that your loved one is sick and they don't realize, you can actually also take them to the hospital. Yes.
All right.
The police also can if they find somebody on the streets who appears sick, they can take them to the hospital for assessment, and they can be treated. Yes.
Obviously, in Kenya is one of the countries where suicide has been criminalized. Many other countries also across the globe have the same principle. And if perhaps you're caught and you attempted suicide, do you tend to get the necessary health care that you need, as opposed to, you know, first being taken and, you know, hauled to jail because of attempting to take your own life?
By the time somebody lands in the hospital, and in this case, those who have attempted suicide and have gone through the criminal system, and they end up being sent for treatment, they end up in Mathari Hospital. By the time they are sent to Mathari Hospital, they've really spent a lot of time in the either police stations or remand, which is rather unfortunate. So with time, we hope that suicide attempts will be decriminalized, so that people can get the right care straight away. They go to hospital rather than having to go to a police station or to a remand before you get treatment. And that way we can also be able to actually be able to tell how many cases of suicide we're having, because right now there are estimates, because some people will not want to say their loved one died of committed suicide, and if somebody attempts suicide, and they don't die, they also do not want it known.
Yeah,
First of all, private insurances will not even cover it, so people will not want it known by anyone. So as we decriminalize it and as we reduce the stigma, then we would be able to have more people come out and talk about mental health and mental illnesses and access treatment as well. Yes.
All right, I'm informed our time is up, but I'll just give you a minute to look into that camera and perhaps tell us, how do you think we can be able to change this particular statistics, trying to prevent at least 3 to 4 people trying to commit suicide every day?
I would want to tell Kenyans that if you know your loved one behavior has changed, like they are withdrawn, they are not happy, please let them seek treatment, and that there is no health without mental health. So if you're mentally unwell, but physically you look okay, then you are not healthy and you'll not be able to reach your potential, you'll not be able to adjust to life, and you lose a lot of time, which you would have actually been able to contribute to the society. So I would encourage each one of us, if you feel you're not managing, you're not enjoying your work, you lose interest in your hobbies, or you feel you're not sleeping well, or you tend to have to drink alcohol to deal with your issues, then you need to seek treatment.
It's not just about taking leave thinking that your body is tired, you need to go and get help.
Yes, although rest is also important. Yes.
All right. Yes. Thank you. Unfortunately, our time is up, but we do appreciate you finding time to come and share more insights on this. And of course, you mentioned that World Suicide Prevention Day will be coming up on the 10th of September. Where will it be celebrated? It
will be celebrated in Embu, and World Mental Health Day is on October 10th. It will be commemorated in Nyeri.
Okay.
Yes.
Well, you have the information. It's very important for you to take this seriously, given that the statistics are showing that many of us are suffering from mental illness, but we don't know where to get help. But obviously there is hope, because this is a conversation that has begun. Dr. Syengo Mutisya, consultant psychiatrist, shedding more light on this particular issue.